I'm just going to read it the way the person wrote it. So that as a young woman in my late 20s, how do I deal with negative body image?
Body image, positive body image and negative body image. In the interest of those who don't know, body image is how you feel about yourself, your appearance, your body build up, and all of that. And some people have come to accept themselves and appreciate themselves the way they are. So they will be termed as those that have positive body image. And then some are not so appreciative of their body image, or they are teased about their appearance by other people. So they are termed as people that have negative body image. And generally, some of these things are born from probably what the society where the person grows accepts as the ideal body type, and they seem to see themselves as deviating from that ideal, and they are teased about it and all of that. Now, how do you know when somebody has a negative body image? They are overtly conscious of their appearance, always looking at themselves in the mirror and feeling bad about certain parts of their body. They talk down on themselves and they compare themselves with other people, particularly those they see as people that have the ideal body type. And they could even go as far as being envious of those people that have those supposed ideal body type or appearance. I want to say here that it's important that we know that whichever way you are born, you are wonderfully and beautifully made. That's what scripture said. Now, remember that there is genetic, your build is based on genetics. And how God made you is how you have been born. So we need to learn so how to handle it, right? We need to learn to accept genetics. That this is the way I am built, this is the way I am made, and I have to accept myself like that. Secondly, be friend to yourself. Love your body. Appreciate yourself. And then recognize that there is negativity out there. And people are very fond of laughing at other people. Recognize that that exists. And also prepare to respond to it and push back when it comes. Like I was saying before we went live, I used to tell my children, before somebody yabs you, yab yourself. If they want to tell you you have big head, before they complete it, help them to complete it. Tell them, yes, I have big head because I have plenty things to think in the head. That's why the head is big. If they tell you you have big nose, tell them I need more oxygen than you. No, my husband used to say that when people tease him that he has big nose. He say, yes, I need more oxygen than the rest of you. That's why my nose is big. There's negativity out there. You may not be able to change that, but you can change how you respond to it. Because that's what, if you don't handle it very well, that's what results in that negative body image that pushes people to do extreme things. So accept genetics. And this is your configuration, this is your composition. You are born from a mixture of genes from your mother and your father. Now, can you think about now the people that always make you have negative body image? Can they create a strand of hair? Maybe you should think about it and ask them. You are laughing at me that I have big breasts. You're laughing at me that I have flat nose. Can you create a strand of hair? No, they cannot. And another thing I want you to recognize, when you see people talk down on other people, they themselves are not comfortable in their elements. They are not. They are feeling terrible about themselves. So making you feel bad is a form of compensation for them. That yes, they project the negativity to you so that they too can feel good. That okay, I am not alone. We plenty we plenty way no fine. You get. So those are some of the psychology around that projection of negative body image. You are beautiful, you are wonderful the way you are, the way God made you. So don't let anybody push negativity to you. Be appreciative of your body, accept the genetics, and then lastly, talk to somebody about it. This negative body image is at different levels for different people. Some people can easily snap out of it when they hear comments like this. But for some, it may have come a long way, and this probably is already affecting their mental health, their psychology, and they might even start nursing suicidal thoughts, or even doing something to their body, even going as far as going for surgery and all of that, to take out the part that they feel is not good enough. So once you have gotten to that point, you need to talk to a counselor. You need to talk to someone that can walk you through that journey, of recovering yourself and accepting and appreciating yourself the way God has made you. So at that point, please reach out to somebody. And we are always here. Our lines are always open. If you need to talk to someone, please, we are here, and we would be glad to walk with you through that process till you are able to overcome and be comfortable in yourself again. Thank you.
Thank you so much, Pharmacist Lucy. A follow up question on that, and it's for Dr. Bello. Person is asking, what are your thoughts on breast and hip enlargement? Are there really any side effects? The people I know who have done this seem to be doing just okay, but others make it look as so bad as if it's a sin. Dr. Bello, hip and breast enlargement. What are your thoughts?
Enlargement, what I did, I compared to just wearing a wig as a woman that wants to wear a wig. Used to wear fine, look good, feel good, that's good. But I don't see sinfulness in that aspect. If the motive to look good and feel good, if both is not for seductive purpose and any other purpose that doesn't have pictorial, uh, but during breast enlargement, one advice that always of course, be sure that's what you want. Because we've seen people do breast enlargement and later they didn't like what they got, and then they still go further and try to do something else. You find yourself moving from pillar. The same thing with buttocks enlargement or deep enlargement. If that's what you want, be very, very sure this is what I want. You know, it, it, after being sure what you want, you also need to research yourself, try to find out where I can get it done. Because, I mean, nothing that doesn't have complications, anything that has to do with a knife going on your skin, on your body, definitely there may be complications. And some of the things that I use in life are mostly processed. They're processed. Most enlargement are done with silicone prosthesis, which are inserted there, and then they are, they are very the design to make it look so after people have feeling that oh, I'm carrying something that, that become another psychological trauma for those who have been what you want in life. Uh, to use to uh, need it used to otherwise, yes, what you want. Enlargement.
Thank you so much. Thank you so much, Dr. Balo. All right. So, the next question is for you, pharmacist Jimmy, and this person is asking: Is it advisable to take over-the-counter drugs and herbal drugs at the same time? You combine both Gugulishe and paracetamol.
Okay, so I'll start this way. Actually, this platform is to promote health, and I think the topic is health and wellness. So, um, drugs generally can actually go in two ways. Either it comes in the prescription form, or the ones you can just get over the counter, and that's why it's being called over the counter drugs. All right. So, most of these over the counter drugs are orthodox drugs, like drugs that are synthesized in the lab, so they come in chemical formulations and stuff like that. Okay. Unlike the herbal product or the herbal drugs, these are drugs that are more natural and also can also get them over the counter. Now, a straight answer is will be no. You can't use an over the counter medication with herbal medication. But how be it, things are evolving. All right. Now, I think in Ghana there's a association that is called Traditional Medicine Association. That what they do is they checkmate the safety of herbal products. Okay, in Ghana, and I think something like that is also springing up in Nigeria, and they're actually checkmating the safety profile of all these herbal products. All right, so that's some medical issues or medical diagnosis that actually um, herbal products are actually very good or can solve or can help in relieving
Managing.
the symptoms that actually comes with such disease conditions. So I would say before you take any medication, actually please consult a practitioner, a licensed practitioner, so that he or she can tell you, okay, for this thing you are licensed to go get this thing, either as over-the-counter drugs or as prescription medicine. So I would say no and yes. Yes, in the aspect of it's something that a licensed physician is actually asking you to get or use with an over-the-counter medication. Yeah.
Thank you very much for that. Very
Okay,
precise.
I just add something before you leave them. Now, I'm saying this because we discover that in our own climb here, there is a lot of self-medication that happens. You know, someone is feeling sick, you just go to a patent chemist. They mix malaria this thing for me. Someone is every symptom is malaria. You're feeling unwell, mix typhoid medicine for me. And the illiterate person that went to go and learn trade from the market on how to sell, medicine will now put antibiotics too, pain reliever too, and give them, and they take and they get immediate relief, and they feel they are okay. Resistance is already setting into that antibiotic, and they did not take complete, and all of these things, will build up. There was a case of someone that I just learned a couple of days that passed, not feeling well, and was going to chemist to go and buy medication. Going to chemist to go and buy medication, not knowing that the case got really critical, and the person actually had, you know, ruptured intestine, of which if there was a visit to a proper hospital and probably some investigations were carried out in the lab by way of lab test and all of that, maybe this life would have been saved. Someone close, someone really close, just passed yesterday. And I'm saying this to let us know the danger of self-medication. You don't just walk into a chemist and say, mix drug for me. Or you just see people advertising herbals on the streets and you just buy and take. Some would actually buy orthodox medicine and buy herbal and take them
At the same
together.
time.
That probably may be overdose, you do not know. So, for the sake of your organs, because all of them, they are synthesized through your
True.
organs, your heart, your liver, your kidney. And that's where they pass through to be eliminated. And they leave residues in your body that will cause more harm than the temporary pain they are relieving you from. So it's very important that we learn to pay attention to our health, get the help of professional licensed practitioners to prescribe medication for you. Don't just go and self-medicate. Even me as a pharmacist, When my kids fall ill, I know what to use, but I do not. I always do take them to the hospital. Even myself, when I feel unwell, I go to the hospital. I go do lab test and know what exactly it is before we would embark on any remedy for that matter. So please, it's something we need to pay attention to.
And I think because of the poverty in the land that
Yes.
actually make people to just take whatever they like and take. So we need to be very conscious of our health. It's not just about the money.
Mm.
But some people will even have the money, but they just believe that drug is not what they should spend their money on.
Mm.
Okay, so they are not living a healthy life and they expect to be well. So
Mm.
you need to invest in your health and then make sure that um, you are meeting professionals to explain things, because if you meet those side
Roadside.
and all that, they won't tell you the rationale behind these drugs, and they
Yeah.
will just
Because they
prescribe,
don't even know
and they are
it.
after money, so they
Mhm.
will just give you the drug and then keep the money, but your own health is at stake here.
Yeah.
So you need to be very conscious of that.
Thank you so much, pharmacist Temi Tokwe. Right back at you. Question here is COVID-19 real or is it a scam?
Well, COVID-19, I also still find it difficult to believe it, because with the kind of how it's being said that it's being transmitted, you know, it's very difficult to actually believe. So I'm not surprised that you are also curious to know. So I would advise that if you really want to know, do your own research too, make informed decision, because that's what I'm also doing too. And I'm the type that is very I'm very obsessed with healthy living. So whatsoever it is, whether COVID is there or whatsoever, I know I'm fine, because COVID-19 is a viral disease caused by a virus called SARS-CoV-2. So, and it's the people that are mostly at risk of that are the immunocompromised ones. So if you are the type that you are always stressed, you are not living healthy life, so whether the disease is real or is not real, then that means you are vulnerable. So I think you should concentrate on living healthy, so that you can be safe from whatsoever, whether it's COVID-19 or other viral diseases, bacterial diseases, fungi, and the rest. So if you live healthy life, then you are sure of not falling into these kind of diseases.
Well, thank you very much. Thank you very much for that concise answer. Back to you, Dr. Bello. The question here is about malaria. We know malaria is very prominent in Africa and in some places in the world. Said, I have this problem of reoccurring malaria at least every 2 weeks. My house is covered and free from mosquitoes. I use a lot of anti-malaria. How do I stop this?
Mhm.
You can have recurring malaria. That why some have had situation of people who have once they just start just give them ordinary
Placebo.
tablets that look like malaria medicine.
Malaria.
Exactly. Mm. Psychology. Yeah.
Malaria,
Indeed.
if
Mm.
you malaria, in the liver, clear the way. You need to work healing malaria. So that two things the doctor can
Thank you so much. Thank you so much, Dr. Bello. That's a very good answer in my own judgments. Please remember that our medical professionals are giving their own ideas, and whatever medical condition you're facing, always seek or consult your doctor. You really must place this caveat. Whatever medical condition you're facing, always seek a doctor or a certified medical practitioner for um, ideal, or go through what the investigation that is needed or required for it. These are just general, na general talk they talk. Oh, you no go say Dr. Bello said you take it for 14 days, you now. So thank you so much for that. But moving on to the next question. This question is for pharmacist Lucy. And the person is asking, please share your thought on fasting. Is it really good for the health? Now, I want to add something. There is fasting, and then there is you staying away from food. When
Yes.
yes, starvation. So let's clarify that when a person is fasting and a person is starving, then what are the health benefits of fasting?
Yeah, okay. So, a direct answer to the question, is fasting good for the health? Yes, fasting is good for the health. Why? Fasting triggers a natural way of your body to clean house. Just like you take a day, let's say Saturday, to clean your house. Clean your kitchen, mop everywhere, move things around, sweep out all the dust. That's what fasting does in your body. It's a way for your cells to clean out all the old and damaged parts of the cell, and then it results in what is called cell rejuvenation, and then your cells are renewed. You feel as good as new. That's what fasting does for your body, and it's something we need to do from time to time, as often as we can. So it's very, very good for our body. There's something also called intermittent fast, and it's actually started getting popular from last year. On social media and all of that, you hear of intermittent fast. So basically, intermittent fast is about having an eating window,
Mm.
a time where you should eat and then abstain from food at the other times. Now, at the times where you abstain from food, it gives your gut time to rest. When that rest is happening, your metabolism is improved, and it helps to digest the food you have eaten completely, and the elimination happens better. So you cannot afford not to fast if you want to be healthy. Sometimes, yeah, fasting has spiritual undertone to it, but it has a lot of physical advantage or benefits for our bodies. So it's very good for us to fast because it's a way of cleansing our system, you know. And again, I would encourage when you're fasting to always take fluid. Always take fluid. Your body needs to stay hydrated. Body needs to stay hydrated, and it helps in the process of the cleansing, that goes on within your body. Now, starvation is another issue. People starve for different reasons, and that is not healthy. When people want to, maybe they feel they are overweight, or maybe out of depression. So people respond to depression in different ways. Some get to eat so much and get obese. Some get to stay out of food and get anorexic. They will not eat and they will grow lean and all of that. That's starvation. Now you're depriving your body of all the essential nutrients you're getting from your food to grow. And that would, predispose you to diseases or your body system breaking down. So starvation is not recommended, but yes, fasting or intermittent fasting is very crucial, and it helps in your body to cleanse itself from time to time, rejuvenating yourself, and you feel a renewal from within.
Thank you so much. Thank you so much, ma'am, for that question. Now we'll look at questions that relates to fertility. First, I would ask this question. It's for pharmacist Jimmy. All right. Uh, this person is asking, I am 31 years old. With which drugs can I use to solve premature ejaculation and watery sperm? I'm shy talking to a pharmacist or a doctor about it.
The first approach I would want to go about it is this way. In getting a solution to any medical issue, you need to pick up, alright? You need to pick up because that way you can find solution.
Let's be specific. Speak up to who?
Okay, now pick up to a professional. All right, now for that kind of cases, a gynecologist would actually come into play. All right, maybe book a visit to your gynecologist, maybe with your wife or your spouse. Book a visit so that a thorough examination can actually be profiled. Now, I won't be here to tell you this drug, that drug, because holistically, I'm not viewing you. There are some results, there are some lab results, tests that need to be conducted so that we can actually specify what is actually wrong. All right. So, but it could also be something that is emotional. Maybe you are the kind of person that you are emotionally drained at that point. So that could also affect your libido. Okay, that will give you that kind of response to having premature ejaculations or watery sperm. Okay. Also, something that can help you to boost such situations. Yeah, good food, food that are rich in all the essential classes of food is what I will prefer to you. Maybe you could increase your fluid intake. Okay, good fluid intake. Get supplements that may boost such cases. There's some supplements that are specifically targeted that can help you boost your libido, sexual libido, so that such cases can actually. But I will also say, see or book a visit to your gynecologist so that a thorough outlook can actually give you a picture of what we're actually targeting.
Thank you so
I'd
much.
like to add to that before you leave. Maybe if the person that asks this question, if you know that you are not alone in this issue, maybe it would help you. A lot of young men lately are seriously having these issues with erectile dysfunction, premature ejaculation, and watery sperm, and all of that. It's becoming very common. You'll be shocked. Becoming very, very common amongst young men. So I want to tell you that you are not alone. Now, if you know comot, you go think say na your papa farm na im big pass. If you don't talk, you will think you are the only one that is having this problem. You are not alone. Okay? So please, and if you don't talk about it, you will not get help. Your doctors are there for you. Your pharmacists are there for you. And they have seen plenty of cases. You will be shocked. So don't die in silence. Self-medication does not help. I talked about that earlier. It does not help anybody. It might get the matter worse. Why? Because you don't know the particular thing that is causing your own. If you hear someone, oh, and like so they do me, now waiting I use be that, and you go and buy it, it may even cause more harm than good. So you, because the causative agent of your own may be different from his own. So go and see a doctor, get tested, and then from talking, they would know whether it is pathological or psychological. Some people just men not performing in the office, their whole system shuts down. You know, and if you're able to just feel good about yourself and be encouraged, you see that your body will come back and start to function and all of that. So please don't die in silence. You need to see a doctor. You need to get tested. You need to get examined. Let them know how best to help you. Thank you.
Thank you so much. Pharmacist Temitope, there's a question here. I'm a married man. Okay, I've been taking this question. I've been taking my birth control pills, and I get scared that one day I might forget to take it. What should I do when I forget my birth control pills? When I forget to take my birth control pills?
To prevent pregnancy. So I think she understands that. Her doctor have tested her because there are different contraceptives, and it's not every contraceptives that work for everybody. So I believe our doctor has checked her and see that birth control pill is the one that is best for her. So she needs to be very intentional about taking it so that it can the drug can serve her better, because if she miss a pill, I'm sure that was why she's scared. If she miss a pill, it will make her she's going to be pregnant, as in she will be exposed to having pregnancy and the rest. So it is not about being afraid now, it's about you knowing what to do and then doing it right. So one of the ways you can prevent missing your pill is putting it in your schedule, as in a routine. There's many apps now that you can actually use. You can even set alarm. Okay, I also use routine drugs too. So what I do is that, early in the morning, that's when I take my routine drug. So I put it in the bag where I put my makeup. So anytime I'm carrying my I will have to use my makeup now, so I put it there. So as I'm taking my makeup, I'm picking them too. So you too, you can look, actually, because you know that you just have to not miss this pill. If not, you get pregnant. So you just have to very intentional. It's not just about just being scared. You need to do something about it. So make sure that you work out things, do something, set alarm. Okay, 2 p.m. I'm going to take the drug. You take it. So peradventure, because you are not alone. So even the manufacturers, they know that yes, you might forget a pill or two. So if you check the leaflets in the pack for specific one, there are combined one that has estrogen and progesterone. There is a way you can actually work out. Just check the leaflet, you see what they will tell you what to do. Or the progesterone alone, just check it, you know what to do. Okay, so most of the time when you miss a pill, it means that you have, after 24 hours you did not remember to take it. Okay, so probably the second day after 48 hours, that was when you remembered. Okay, you take the one that you mix. Okay, and then you take the one that, so you are taking 2 pills that day instead of one, the one you miss and then the one of that day. But you must make sure that you use extra contraception too, like condom, because especially if you are the one that is very fertile, some people, they will say, It's just one, because if you miss a pill, you are going to ovulate, especially if you are the, some, no, it's not everybody that is. Some people, they will just, you can miss a pill and then nothing will happen, but if some people, they will miss it and then they will get pregnant. So if you miss a pill, and you have unprotected sex, you are it's 50-50. So you just need to use extra additional contraceptive like condom to make sure that you are not you are more protected. So you take your pills, and if you think it can't work for you, you can still go back to your doctor and tell the doctor that it's not just working. So the doctor will know what else to do. But you can actually work things that is not hard. Take away the fear and do the right thing. That's it.
All right. Thank you so much, Pharmacist Temitope. Still talking about condom. We have a question here. I'm a married man. Is it okay to use Vaseline as a lubricant with a latex condom?
Lubricant is like a sex enhancement tool. Yes. Okay. So it makes people it makes sex more pleasurable. So Vaseline is a oil-based ointment, and it helps to soften and moisturize skin. So some people actually think that is the best thing to do. Although yes, it's going to work, but it can damage this latex condom we are talking about. So there are specific pharmaceutical gel that have been produced for that, for sexual lubricant. So you can actually look for that instead of using, because you don't want to encourage infection. Because if the condom is damaged, you can introduce germs into the vagina of the lady, or because this Vaseline and the rest, most of them contain perfumes, they contain essential oils or parabens that can upset the normal flora of the vagina. So now, if you really if you are the type that you just want to take the health of the lady into consideration, and then you need to be careful about what you to introduce into the woman's vagina. So you need to be conscious of that to prevent infection like bacterial vaginosis, to prevent cervical cancer. Okay, those are the things that can happen. So Vaseline actually attracts germs. Vaseline attracts germs, so it is important for you to make use of the pharmaceutical um, produce gels that are produced specifically for lubricants. Okay.
Thank you so much, Pharmacist Temi Tokwe. Dr. Bello, this question is for you. And can a woman get pregnant while breastfeeding? Can a woman what are the chances of a woman getting pregnant while breastfeeding? Some people tell you that breastfeeding is a
family planning.
natural contraceptive.
To some
So,
extent, yes.
okay, to some extent. Okay, so Dr. Bello, breastfeeding and pregnancy.
Breastfeeding, yes. Why do can't
Mhm.
justify breastfeeding our partner.
Really.
Several women who got pregnant while breastfeeding. So although it's good to protect some people and keep them away from pregnancy during that period, is not a very bad thing. We would rather fight for the combination of breastfeeding and means of preventing pregnancy. And if can be done between the man, woman, and children, that can also combine with the breastfeeding. But the life story of breastfeeding and prevent pregnancy is very, very easy. There is always a breakthrough pregnancy while women are breastfeeding, because the message out there is that breastfeeding is contraceptive. but it's not a reliable one. There will always be pregnancies, and there are several things that so don't rely on breastfeeding alone as a contraception during after delivery when you're breastfeeding. It's good to encourage breastfeeding. It's very good. For some women, breastfeeding alone is not as contraception, but how to determine that is very difficult to determine, except in fact you get pregnant at breastfeeding access to them as a contraception. But the thought while breastfeeding they allow contraception and ended up you must try to combine it with pharmaceutical means of contraception.
All
Thank
right.
you.
Thank you so much, Doctor. Um, there's a question. The question here. What are the benefits and risk of circumcision for newborn? Pharmacist Jimmy. I'm very deliberate about this question because the person was specific newborn,
For newborn.
wasn't about whether male or female. So maybe we'll look at it. What circumcision for boys, circumcision for girls? What are the benefits, if any, and risks?
So what is circumcision? That's the first question that comes to mind. What is circumcision and who circumcision should be done for? Okay, no. So basically, circumcision is just a procedure in which some part of the body is taken out. Okay. Now, so
When you
how,
say some part of the
okay,
body,
I'm going to be specific
Uh-huh.
as we proceed. Now, for male children, the ideal procedure is maybe on the first or the second day after birth, circumcision should be done, or on the eighth day. Now, for the male child, a part of the body called the foreskin is actually rippled out, so that the gland of the penis or the penile can actually be protruded outward. Okay, so why are we doing that for the male folks? Now, we've discovered, or researchers actually giving us things to
evidences.
know that when we do that, it helps with good hygiene. Okay, circumcised male child have good hygiene in their genitals when compared to a male child that is not circumcised. So now, if a male child that is not circumcised does not have this good hygiene, then infection can cripple in. Either bacteria or sexually infections can also can cripple in. Then two, the patient can have irritation, smells, okay, because something is covering something, so it's not getting the enough air that will give that place good
Hygiene.
view, yeah, hygiene, yeah. So now, when it comes to the female gender, um, actually something like that, circumcision was done. Then it came to the limelight that there's no beneficial role when you do circumcision for the female folks. Okay, now it's now termed female genital mutilation or female genital circumcision, and we're like, okay, why are we cutting out either the clitoris or the major or the minor labia from the female folks? There's no beneficial effect, because most of the female folks or female child that have undergone circumcision comes back with emotional drainage of when they're married, they don't have yeah, their sexual life is impeded greatly. So the WHO have actually brought a memorandum that in 2025 they want to stop circumcision for female folks, and that project is actually on in different countries, because some countries that are practicing it are the Middle Eastern area, the eastern part of the world, like I think in India, and some part in Africa still practice circumcision for the female folks. So basically, if your newborn is a female folks, a female child, please don't circumcise that female child. But if it's a male child, please, circumcision help in keeping good hygiene for that child. Yeah.
Thank you so much.
So it would interest you to know that why do they circumcise the female child? Because they say they want to curtail promiscuity. How ignorant. Because it doesn't actually stop promiscuity. So that was born out of the tradition of keeping women chaste and all of that. So it has got nothing to do with the hygiene that is implicated for that of the male. So it was for a very wrong reason that they do the female genital mutilation, so that she will stay pure, stay to her husband alone, and not because they know that the clitoris is the major organ of sexual pleasure in the woman. So when they rip it off, she would not go looking for sex outside. That is the main reason. And that was a very, very ignorant, it's a myth. So based on that, female genital mutilation is baseless and should be discouraged as much as possible.
Thank you for that, Pharmacist Lucy. There's a question here, and Pharmacist Temitope, please you help us with that. I have never had orgasm during intercourse. Is there something wrong with me? It can be female, it can be
It
male.
can be a male, it can be female, anybody.
Anybody.
Yes.
When I was like, it can't be a male.
Don't be too sure. Don't be too sure.
Because it's rare. Actually, because it's females that we are always concerned about, I'm not coming, that's what we call it. I'm not coming, I'm not having it. So we have that fear. So I'm going to relate it to the female because I believe it's the female that is asking that. So sometimes you will come, but as in you have orgasm. Let me use that because that's what she might not understand the coming. So, but most of the time we don't know that we actually have that orgasm because we are thinking of this dramatic thing happening because of what we watch on TV or some kind of sexual things we are exposed to. So you will be thinking it's supposed to be like this, supposed to be like that. I'm supposed to be shouting. I'm supposed to be silent. So it's not. So you might be having that orgasm, but you don't know because you are expecting something else. So okay, if let me just assume you have not experienced it, and that is called anorgasm. That is okay, primary, because some people actually experience it and then later they stop having orgasm. They call it secondary anorgasm. And then the one that she's talking about, she said she has not experienced it at all. So that is the primary one. So, and different kind of things can cause it. It can be psychological, like this negative false sexual experience. Some people they are being raped, or some kind of things happen and they experience some kind of trauma why their first experience, so they don't really have. So that is the psychological part. Then it can also be you are afraid of not getting pregnant, okay, or the fear of you are not doing it well, or low self-esteem, stress to can. Those are the psychological aspects of it. So it's actually fear that triggers that. Then we can also have the physiological factor that affect that you not having that orgasm or that pleasure, sexual pleasure that you are talking about. It can be you are on medication like antidepressant. It actually lowers female libido. And then hormonal disorder. Yes, if you are your hormones are not balanced, you are having some kind of estrogen dominance, or you don't ovulate regularly, you might actually have that kind of thing. Okay, you can what also causes it is nervous system disorder or cardiovascular disorder. So those kind of things can actually affect it, and if you really want a solution, you need to meet with your doctor, and then it's going to ask you your experiences and the rest, so that you can, it is from what causes it that you can actually rectify it. Probably you might be taking a drug that triggers it, so you need to stop taking that drug to encourage orgasm. So another thing is relationship. Maybe that's why we need that body literacy. We need to be self-aware of our bodies. You need to communicate your
Sexual
what is it?
desires.
Your desires to your husband. Touch this place, my nipple. That's where I, because most of women, they are shy to even communicate those desires with their partner, their husband. They are shy. Okay, so you need to communicate that so that you can experience that pleasure. It's not just only your husband that should enjoy it. You too, you need to enjoy it too, and that is how you can then introduce foreplay into your sexual interaction too. Right? Think about it before you go into
Right.
the action. Cuddle yourself, write love letter to one another. Start imagining things before the action.
Fantasizing.
You start. Then when you are there, cuddle yourself, smoosh yourself. Don't just go straight, because you will not reach that climax. So it's just a way of knowing yourself. Remove fear, remove whatsoever psychological influences that may. It's just by the time you put things in order like this, you see that you experience it. You might think nothing is wrong with you. Actually, it's just this education. Try and understand your body, know more about yourself, take away fear, know what you are taking, the drugs you are taking, whether it's all these things is just simple thing. If you can look at it and then communicate our desires to our partners, and then you see that orgasm that you are thinking you have never experienced, you start experiencing. It's just a matter of putting things in place.
Thank you so much.
I'd like to also add that let me go with her assumption that it's a woman that is asking the question. Now, the husband has a lot of role to play in this, because for for maximum sexual pleasure to happen, it takes two to tango. Now, for a woman that has never experienced orgasm like she thinks, a lot of work needs to be done by the husband. A lot of patience is needed. So if the husband makes it a goal that, no, my wife must get to orgasm, it would affect, because sometimes some women need time to build up, and it starts way before bedtime or way before whatever time you're meeting for the sexual intercourse. Prepare yourself psychologically, you desire yourselves and all of that. Then the husband will patiently wait. Because if the husband just bangs, bangs, bangs and gets there, and the woman is just building up, show is over. And then tomorrow we start again, the same thing. At the end of the day, the frustration will begin to set in. But the husband has to practice a lot of self-control and be able to wait for the wife to be able to build up and get to orgasm. So two of them need to work together. Find out what works for her. If she is shy to tell you where she gets the most pleasure, you work with her, help her to see that she's able to talk about it, know her sensitive parts. We all respond differently to different parts of our bodies. So don't assume it's a one-size-fits-all or this is what works. A lot of the things we watch deceive us a lot. Yeah. So let's find out what works for each couple. Find out what works for you and be willing to wait for one another. Make it a project that both of you will see to it that it comes to fruition.
Thank you so much. Thank you so much for Mrs. Lucy. We have this question. I'm 36 and I look more like a teenage old boy. I really need to look matured. As I get teased and bullied even at work, what do I need to do to achieve a more matured look?
So it's almost similar to the question about body image. At 36, you look small and you are being teased at work. That got me a bit concerned. Now, your perception or the perception of you that people have is not so much about your stature. It's about what is from within. What is your composure about? What is your strength of character? What is the quality of your life? You are 36. Are you acting 20 or 15? Or you're acting like a teenage boy, which would actually give room to people to tease you you know. So those are some questions that need to be answered. How do you carry yourself? Like I said, pretty much the way we are is the way God has made us. Genetics has the final say to a great extent, and we must learn to accept it. Now, moving on from there, you need to work on yourself, your internal self. Carry yourself, you know, well to be able to be respected so that people cannot just tease you and bully you. He said he's been bullied, and bullying is real. Bullying is real, and people need to learn to push back. We need to speak up about bullying and learn to push back bullying. Bullies are in themselves suffering. So bullied people get to bully other people. So it's like an evil cycle. They themselves are suffering some pain and damage as well, and they project it. So it's still the same thing playing around in different ways. But we need to learn not to accept bullying from people and sit with it. Push back. Don't allow anybody bully you. But then you need to be mindful of how you carry yourself. You need to be mindful about your comportment, your composure. Develop yourself from within. Act like the person you ought to be, you know, and you command respect. You don't demand it. Yes, you command respect. You don't demand it. If you demand it, they will laugh at you. But when you command it by the way you carry yourself, they cannot talk to you anyhow. You know, that's one. But, you know, some other physical things that you can do that would make you. Like I know of someone that has a very small stature and decided to keep hair, you know, decided to keep hair so that it will make him look big and presentable. And sometimes you want to keep beards, you know, at least enhance your facial expression. Grow beards that would make you look your age, you know. Those are some physical things you can add.
What about dress style? You were wearing
And,
short
and
knicker every time.
exactly, your dressing too. That's part of your carriage. So carry yourself like the person, like the 36-year-old that you want to be seen as and respected as such. So that's very, very critical. Yeah.
Thank you so much, Pharmacist Lucy. Dr. Velo. Okay. All right. Let's just continue. When he comes back, I'd ask him one or two questions. Now, Pharmacist Jimmy, there's a question about exercise. How much of exercise does a person need? How much of exercise does a person need? And how regular should
Around, walking, jogging around the room, and stuff like that. So exercise can be done any time of the day. Now, now for the duration, how long can I do these exercises? I would say that when you are engaging in good habits, um, you can actually raise the bar. Okay, as much time you can create for such exercise plan, please go ahead and do such. Okay, so I won't want to limit you. Do it for a particular specific time, maybe 30 minutes or 1 hour, but as much time you want to engage yourself in such exercise program, that's fine. Okay, so if it's swimming, if it's walking, if it's just doing some quick jogging around the neighborhood, okay, as much time you want to allot time for that, I think that's enough.
Thank you so much, Pharmacist Jimmy. Dr. Bailo, this question is for you. Dear facilitator, with so many Chinese herbal teas and supplements, how are we able to differentiate the fake ones from the original ones? As same with over the counter drugs. How do we differentiate fake Chinese herbal teas and supplements, and how do we identify fake over the counter drugs? Dr. Bailo. Okay, so when he comes back, he would help us attend to that question. Pharmacist Lucy, a person is asking, why do I feel hungry immediately after eating? Is this a sick? Is this a sickness?
Okay, it is not a sickness. So hunger is your body's way of telling you that it needs more food. Yeah.
Sorry,
So
ma. Can we differentiate that from cravings?
okay. Generally, hunger is your body's way of telling you it needs more food. Now that's different from cravings. Sometimes you're craving something, you're not really hungry,
Yeah.
but you just feel like eating that thing. And that happens a lot with pregnant women, you know. You just crave something. I remember one day I was craving, was it roasted plantain? When I was pregnant for my second or third child. And my husband had to, it was not roasted plantain. There was something silly I was craving. My husband had to go get it for me or something. So I was not hungry, but I just wanted to eat that thing. I can't remember what it was. So hunger is different from craving. Now, for hunger itself, it's your body's way of telling you that it needs more food. So you will now wonder, but I have just eaten. Why am I feeling hungry again? Now, one of the major culprits for that is the food composition. Yeah, the food composition. Sometimes protein, they are slower at being digested. The digestion rate for protein is slower, so it gives you that feeling of being full for a longer time. And then for food that is composed of fiber, would also give you that feeling of fullness. But when you eat things that are rich in fat and oil and higher in carbohydrates and all of that, they are the ones that tend to make you feel hungry right after you have eaten. So you might want to start tweaking your food composition. Take more of fiber and protein. So it would keep you full for a long time, and then of course keep you food, off eating more food, and give time for the ones you have eaten to digest and be able to extract the nutrients that your body needs from it. So that's basically one of the major culprits.
You know, when we eat carbohydrates, our blood sugar rises up. And when it rises up like that, our brain tells our pancreas to produce it to start producing insulin. So because it's the insulin that will help the glucose to get into the cells. So if you are the type that is insulin resistant, your cell is not getting, you have eaten, the glucose is in your body, the insulin too is high, but there is resistance, is not entering into your cell. So definitely your cells will be telling your brain that I'm hungry, I'm hungry. That's why most people also get that. That's why that's why some people get fat,
Obese.
get because of insulin resistance. And what can help is that exercise that we are talking about, because exercise can encourage insulin sensitivity. So some people at night, especially at night, or probably they have a sedentary lifestyle. They've eaten and then they're sitting in a place. You see that in fact they will start getting tired. They start feeling hungry again, and they are still, sometimes they are full but they are still hungry. You know, their cells have not received that because they are insulin resistant. So we should also consider that the person should try and check his or her blood sugar to confirm if it's not insulin resistant. So if you are the type, your change of lifestyle can actually help, like the exercise we talked about. Make sure that you are doing exercise, you are moving, because that help encourage insulin resistance, and then your body gets the glucose, the energy that it requires. So you find out that if you are doing like that, you will not get hungry
soon.
like very soon like that, because your body is satisfied, you are not hungry.
Thank you so much, Pharmacist Temi Tope. Dr. Bello, this question is for you. It says, with so many Chinese herbal teas and supplements, how are we able to differentiate the fake ones from the original ones? The same question for over the counter drugs. How do we differentiate fake over the counter drugs from original over the counter drugs? Do I take the question again? Can you hear me, Dr. Bello? Okay. So do I go over the question again? The question is about identifying fake supplements and herbal teas and identifying fake over the counter drugs. How do we?
especially with Chinese. You know, recognize you also need to do your homework, do your research. Which one you these are the lot of practice of need to
You have to come and pay NWN for advert.
be used. But then you for you feeling feeling
Yeah. Mm. Mm. Mm.
you we use
Yes, sir.
do this
Mm. Mm. Okay. So I'd like to add that fake drug is a menace that we really have been dealing with in our climb here. And some pharmaceutical companies have gone as far as putting some codes, on the pack of the medication, and there's a short code. You scratch it, and then you text that code to ascertain that yes, this is the original product that you have. So that's what some pharmaceutical companies have gone to the extent of doing to protect the health of our clients that get to use this medication, to ascertain that what they are taking is the original one. So you might also look out for that. When you buy some medications, you see the code on this thing, and they'll tell you to text the code, scratch it, and you text the code to a certain number that will be on the pack to confirm that yes, this is the original one.
Yeah. Thank you so much, Pharmacist Lucy. Dr. Bello, before we go, we have actually exhausted all of the questions that were sent in earlier. Are we taking questions sent via Zoom? Okay, so Dr. Bello, I'd need you to just share your advice on.
You need to be sure of what you need to take into consideration what you're using your body to do. You need to be very intentional about what you do with your body. Don't go to the excessive. Make sure everything is balanced. Don't sleep too much. Don't don't sleep.
No
You
sleep
know,
less.
it's either we go to the extreme or we go to the lowest too. Let everything be balanced. Like eating too. Some of us overfeed ourselves, some of us don't eat ourselves. Okay. Some of us exercise too much. That's why that person was asking, which one is this? How am I going to exercise? Because most of them they don't know how. Some people say you must go to the gym, then others will say you must walk. So it's not food actually, but most of the food we eat, they don't really contain the nutrients. Some of us we don't eat a balanced diet, so we don't get the quality of nutrients that our body needs, and then we stress a lot too. So all these supplements are there to also supplement the food we are eating, and then you need to take it very seriously. Take supplements, try and rest. Rest is very good, because if you are the type that stress too much, your all the food you are eating, the exercise, all the things we have talked here today is going to because most of us we are just surviving, we are not thriving. So by the time we rest, then our body is going to be in that state of digest. Our body is able to digest the food we eat in that state of rest, not in the state of fight or flight mode that most of us are always in. We are always trying to do some things. So if you want to get the full benefit of our exercises, the water we take, the food we take, we need to make sure that we rest. Our body must rest so that we can get full benefit of our supplements, of our food, the water we drink, and so on. So invest in your health.
Invest in your health. That's the final word from Pharmacist Temi Tokwe. Pharmacist Jimmy, you're a specialist in oncology. Please let your final word be related to cancer.
Okay, so I would say for us to actually achieve that optimized wellness, we have a role to play. You have a personal responsibility to your health. Okay, I see some patients going to get some particular medication, and the manual, the leaflet, they don't study it. So how do you know the questions to ask? How do you know the symptoms that will come with such medications or with such drugs when you start using them? Okay, so you need to take personal responsibility of your health. You need to know what you are consuming or what you are about to take. All right, that's one. Then secondly, please always ask questions when you are not clear. Okay, any procedure, maybe medication is to be commenced, please ask questions. Why should I take these drugs? Why should I start this medication? What are the symptoms? What are the so-called risks or hazardous effects that I may have? Okay, so that gives you or prepare your mind okay, or of things that actually would come with such medication. And when we treat cancer patients, that is what we do. We give you the full details of whatever symptoms or whatever side effects that this medication will give to you. But we also come in and say, but the benefit will also outweigh these symptoms or these side effects that these drugs may actually issue out. Okay, so those are the two. You have to take personal responsibility, and two, you need to ask questions on regarding your health. Yeah.
Thank you so much. Take personal responsibility. Your health is your first business, so pay attention to it. Lastly, we'll take pharmacist Lucy.
Okay, thank you. I'd like to quickly share a personal story before I give my closing words. Some years ago, like 4 or 5 years ago, I discovered I started falling ill frequently. Close to my period, I would lose sleep, and then I'll be having this nagging headache. I did all sorts of tests in the hospital. They did not find anything. I mean, very good hospitals. They did not find anything. Spent all kind of money. They couldn't figure out what. In fact, at some point, they were giving me antidepressants just to give me amitriptyline to control the headache. And the side effects that I had to deal with taking that drug was crazy. I'll just be floating when I'm walking, you know. All my sensitivities were numbed and all of that. In fact, the side effects were worse than the headache, the migraine headaches they were trying to treat with it and all of that. And then a friend of mine recommended a doctor, a trained medical doctor that deals solely on herbals and supplements to manage certain cases. I think the guy relocated from the US to Nigeria, and I visited the place. It was not small money, but it was supplements that I was giving. He said I was lacking in macro elements, magnesium and zinc and some. And by the time I got those supplements, all those symptoms stopped. So he said there was hormone imbalance, yeah, because that's why it was associated with my period. I would be wide awake like this through the night, then headache, because I had been suffering from migraine before. So when I'm deprived of sleep, it triggers migraine for me. So I was suffering all round. It was a terrible experience. Once my period is coming like this, I'm scared, and I dealt with that for a long time before I was introduced to this man. So I'm trying to emphasize the need of supplements. We are not very loud on supplements in this part of the world because we feel, where is the money to eat? Sometimes they are not so expensive. The simple folic acid, a simple vitamin B complex, 100, yes, 100 of it is like 200, okay, 350 now. Nation. With 350, you get a bottle of 100 tablets that will last you over 3 months. So I was having that conversation somewhere this morning. I was addressing a group of people and I talked about it and I said it was ignorance. And someone was saying it was poverty. I was like, what is 350 naira that would last you for 100 days as compared to your health? We buy airtime. We recharge data on our phone. So I believe it is more of ignorance than poverty because we can afford it. There are supplements that are cheap. But just knowing that we need it and then the discipline of taking it. Since that time, I have not stopped taking my supplement. You saw when the children I sent for and they brought the supplement. I take it routinely. Yes, I take it routinely. I don't joke with it anymore. And if for any reason I run out of it, I see that my body starts talking to me. I'll start feeling those symptoms again. So those macro elements are needed in our bodies and we need to keep taking it constantly. Just like you are eating food every day, you need those supplements every day. So don't see it like you are taking drugs. Supplements are not necessarily drugs, but they are needful just to make up for what we are not getting that we need from our food. Our food basically is staple food, carbohydrates majorly. How much of protein do we eat? Meat, one tiny piece that we put in the food. Egg, maybe once a week, and all of that. Beans, most people don't like beans. Vegetables, most people don't like vegetables. So we need the supplements, to say the least. we really do need supplements. If you can't buy the big expensive ones, buy simple folic acid, buy simple vitamin B complex. You can't you don't know what wonders that is doing in your body, particularly for women that are 40 and above. But that's when all those symptoms, yes, all those hormonal issues start setting in. You just find yourself getting restless, numbness in your digits, your lower digits, and uneasiness in your body, constant headaches, and all of that showing up. Stop taking the paracetamol. That's not what you need. Take in a lot of water, rest well, then take supplements, please. That's one. Then the second thing I want to talk about is the fact that we need to do total check on our body from time to time. If we keep focusing so much on money, we will die and leave that small money that we have. Why? Because of ignorance. We need to check our bodies from time to time. To do a comprehensive body check is between 20 to 40,000 naira. It depends on where you go. Do that for yourself once in a year. Go and pay to the lab. I think there are some labs that do it. Don't let me call names because they did not pay NWN for adverts. There are some labs that do it. Pay that money. Let them check your organs, check your liver. When I was in the university, now year one in the university, critical to your registration and clearance is to do overall check in the hospital, in the health center of the university. That is part of your registration, or else you will not have completed your clearance to be admitted as a student. It will shock you to know that it was during those tests that some people, I had a classmate of mine, that it was during those tests that she discovered that she was diabetic. She never knew. Guess what? Her mother died of diabetes. And she would have been growing with it until it now becomes full blown when she's much older. And she probably might come down and pass for the same reason. But during those tests, it was detected. And of course, they started treating it. One other young man detected that he was hypertensive at age 18 or 19. Year one in the university, from those tests that we do. So it cannot be overemphasized. Those tests are very, very critical. Save up towards it. Let's take care of our body. We that drive cars, like I'm very particular about what type of engine oil I use to service my car. What do I use to service my body? Car that I'm driving, I spend so much money on it. How much more myself? So we need to rearrange our priorities and know what is important for us. Let's take care of our bodies. Thank you very much.
Well, that's a wrap, people. That's a wrap. You can't get it better than how it has been said and done in plain, simple English. We didn't say it in Chinese, so that you will not say no here. You not say no. That's not what they are saying. Thank you so much for investing your time. Thank you so much for investing your money, getting the information you need that can transform and renew your lives. Remember that your body is the vehicle you need to survive here on earth, and you need to make that investment in terms of your time, your resources, and deliberate personal action. You take action for yourself. Thank you very much. We'll see you next time on another edition of Let's Talk on Navigating with Noel. My name is Bimlicious. Have a lovely night rest if it's night where you are. Have a lovely day if it's morning where you are. Have a lovely afternoon if it's afternoon wherever you are. Just have a lovely whatever. Thank you very much.
Oncology. Don't bite your tongue. Oh God. Yeah, come and remove your rope. Your rope that you tied around our neck. Oh God.